Hi everyone, I am Sam, and at the time of filming this video I am about 15 and a half weeks pregnant, so I am just about into my second trimester of pregnancy. This is my second pregnancy, this will be my second child, but it will be the first pregnancy where I knew that I was autistic. So it's been kind of very interesting to look back and compare and contrast the two pregnancies, because of course every pregnancy is different, but it has been quite different knowing that I'm autistic and understanding myself a lot better than I did last time. So I just want to talk about how it's gone and how it went with my last pregnancy, focusing on the first trimester, and I'll probably do some updates for the second and third. This video is sponsored by Timo, the visual planning app developed specially for autistic and ADHD brains. Timo helps you manage your day, set routines, keep track of the time spent on tasks, and remember things, freeing up space in your day to concentrate on the bigger stuff. With a unique focus on visual processing, Timo is completely customizable and can be shared with up to 5 family members on one account. If you want to learn more, please check out the link in the description box below. So let's start by discussing physical symptoms. Now, for both pregnancies, I could tell really early on that I was pregnant. For the first one, we were actually away, we were in Dusseldorf for the Christmas markets, and it was probably just a few days post-implantation, and I remember that this wave of fatigue came over me like nothing else I'd ever experienced in my life. And actually that day I had to go back to the hotel room to rest 3 times because I was so fatigued. And for pregnancy number 2, the first indicator that I had that I was pregnant was actually my cat. Let me explain. For my first pregnancy, my cat was like really needy and clingy with me, and she was really super protective of me as well. And so a few days after, presumably after implantation, before I took a pregnancy test, I had this day where the cat, this is Storm obviously, came up to me and she just sat next to me the whole day. And she was just gently sniffing my skin, and she also really likes sniffing my hairline here, which I assume is full of pheromones. And she was just sat there sniffing me like this and giving me headbutts and being really sweet and really clingy. And I said to my husband, look at this, and he just goes, uh-oh. So my cat actually is not psychic, but she is a very early pregnancy test if you're interested in, maybe I could hire her out or something. So I'm clearly very sensitive to hormonal changes within my body. But this time round, I actually felt much better than I did last time. I had quite a bit more energy, my appetite was still good, and I felt pretty good until about week 7 or 8, I would say. Which is weird because nothing about having a 3.5-year-old is going to leave you with any kind of energy whatsoever, but weirdly enough, I did have more energy this time. So at around 8 weeks for both pregnancies, that is where the worst kind of first trimester symptoms started coming, but they were a little bit different each time. My first pregnancy, it was food aversions. So the smell of eggs, cooking eggs, any kind of eggs, I could not tolerate. It was like the worst thing that I'd ever smelled. And actually, I had food aversion to eggs throughout my pregnancy until the day after I gave birth, and I was like, ooh, eggs. Which is weird because my son didn't come out allergic to eggs either. I also had food aversions to pretty much all fresh food. So all vegetables, meat, eggs, dairy, fish, like everything fresh and healthy was just like, no. All I could tolerate eating basically was just the blandest of carbs, like toast and plain pasta and stuff. Like actually the stuff that I would eat when I was really small and like had a very restricted diet. But that was because I was very picky, and this time it was because I just the thought of any other food was just awful to me. So that was food aversions. I had some nausea last time, but it wasn't really bad. Those food aversions actually lasted between weeks 8 and 14, so that was quite a long time where I just couldn't eat properly. And it was just awful, it was really horrible. This time around, I didn't exactly have food aversions. I had some cravings, like spicy things and pickled things, acidic things for both pregnancies. I just had very terrible nausea and some vomiting. And that was from weeks 8 or 9 to about weeks 13. So it was actually less time, but it was just much worse and more concentrated. And throughout pregnancy, actually, I think it's very common that your sense of smell is very heightened. So any bad smell can kind of set you off during that period. But that did mostly go by weeks 13 and 14. I was pretty much back to normal. And now I'm like if I catch a whiff of something that's really terrible, you know, like a poo or something like that, then that might set me off a little bit of retching. But other than that, I'm pretty much back to normal in terms of eating. And before you ask, no, I'm not on a ketogenic diet right now, although I'm trying to limit my carbs because I do have a family history of diabetes. I have PCOS. My body is insulin resistant. So I'm eating more carbs than I usually do, but I'm trying to keep it lower. And I'm also absolutely not craving sugar in the slightest, which is strange because historically I've been quite the sugar fiend. But so those have been the kind of like appetite and sickness, those kind of physical symptoms. The other main physical symptom during the first trimester has been my body stretching. This didn't really happen last time because I didn't even start to show until really like I was like 18 or 19 weeks when I actually really started to show a little bit, and then it was like a very modest little bump. And this time round, you know, the second pregnancies, your body just goes, well, I remember this. So I think it was like week 6, I'm like, I need my maternity trousers right now because, you know, it's just uncomfortable having elastics and things digging in when your womb is trying to go the other way. But this is obviously can be quite painful. I can get very sore. It means that standing up sometimes is quite tiring and not very comfortable. Physical discomfort has been pretty bad, but I do now have a bath, which has just like felt like the most luxurious thing, and just being able to lie in warm water as your muscles relax, that's really helped, you know, like the Epsom salts and stuff. So the sensory overload has been quite a lot in that respect, and I've been sore more than anything else. But other than that, my physical symptoms haven't been too bad now that the sickness is over, because that was really the worst. I feel much better than I did last time. I also really had terrible acne last time. My skin, it wasn't just acne, it was like blotching all over, random dry patches. My skin just was awful. I'm really glad that I don't have that, because I would have no idea what to do if I'm trying to film and like put makeup on. Oh, you just have to see my skin. That's one thing that's turned out quite a lot better than last time. Is having maybe a little bit more of a pregnancy glow. I'm wearing foundation, but you know, pregnancy glow. The last physical symptom actually that I did have for both pregnancies was low blood pressure and getting very out of breath when I'm going up the stairs and stuff like that. And last time, I mean, I had friends who I would say that I couldn't walk this far and they would not believe me. And I'm just like, look, I go up the stairs and I start breathing like I've just run a sprint, okay? This is a symptom of pregnancy. This is quite a normal one. The midwives were very uninterested in my out of breathness, even though I was not showing at all at that point. The thing is, your body is creating more blood. You've got a lot going on in your body. It's hard work, and your body has to work harder to kind of pump it round. So don't tell pregnant women just to go for walks. Like, if they're out of breath from walking up the stairs, walking further distances is just not gonna happen. We're not being lazy. Like, pregnancy is tough. Okay, so now I'll talk a little bit about mental health, because as some of you might know, I do have PMDD, which is a very severe form of PMS. And so I know that my mood and mental health is extremely sensitive to hormones. I also reacted, when I first went on the pill way back when I was 19, I reacted very, very strongly to that, and I didn't know why, because it was right when I started university. And it only occurred to me after reading my diary from that time. It was like I start the pill and then a month later, it was like my whole mood just completely crashed. So I know that I'm very sensitive to hormones. So last time I definitely think, looking back, that I did have prenatal depression as opposed to postnatal depression. So I had depression throughout my pregnancy, which I think was partly caused by hormonal changes and partly caused by things that happened to me during that time. And this time has really been very different because, well, having the autism diagnosis has been a massive help. Understanding myself and my reactions to things better has been a massive help. But the thing about this time is that we've all just been through 2020 and everyone's mental health is kind of a bit frayed right now. So I don't think, I do feel a bit depressed, but I don't feel like I have depression or prenatal depression in that way. I feel like my low mood is coming from the state of the world around me. It's really depressing right now, and you know, as I'm recording this, we're still in lockdown in the Netherlands, and we've just been extended for 3 more weeks past when it was due to finish. So I think that the pregnancy hormones have contributed to me being more irritable, less willing to put up with people's BS, less patient maybe, and possibly a little bit more of a low mood at times. Definitely weepy, but like, you know, weepy at just random things. We haven't seen family for what feels like a very, very long time, and we haven't really been seeing friends or anything. Like, we've been really keeping in our house as much as possible. So, you know, I think it's understandable that I have a low mood right now, to be honest. And this is actually what I said to my psychologist. I was like, well, to be honest, I'm feeling depressed, but I'm trying not to dwell on it because I know why I'm depressed. You know, I don't want to be isolated. I want to see people. I want to have people coo over my burgeoning womb goblin. And by the way, I'm not saying that if you're depressed right now in pregnancy that you should ignore it, but I kind of like know myself, and I know that like, okay, I feel sad, but I think I know why. Like, if you feel like you have depression, definitely talk to someone about it. It's just like, mine's being managed, you know. So basically what I'm trying to do is I'm trying to just kind of get through the next few weeks and months and have a few things to look forward to and concentrate on the good things. So talking a little bit about autism specific things, I have mentioned sensory overload a couple of times already. This to me is kind of like quite a big part of pregnancy. I'm very sensitive to things going on in my body that alarms other people that I'm so sensitive to it. So pregnancy is a really big deal for me. Like, I can't just be a normal person in pregnancy. I know, because if I get like too much blood to my head, I'll get a headache. Like, you know, I'm just like the princess on the pea, the pregnant princess on the pea. And the thing is, if you don't know that you're autistic and you experience this sensory overload, you actually kind of think, I actually thought last pregnancy I was going insane. And it's not nice to feel like that. So the sensory overload is something that you kind of have to manage, and you have to be very careful of your own boundaries in terms of saying, okay, I recognize this is happening now, and I need to take myself away from the situation. I need to find somewhere dark or quiet or peaceful or whatever. So obviously having people around you who understand that is also helpful. The other autism specific thing I've done is that I created a document, which is kind of like a care document, which I sent to the midwives to try and help them understand a little bit more about how autism affects me, because I said to them that I'm autistic, but unless they know what that means, then you've got no idea what you're actually communicating with that. So I thought it was very important that I said I'm autistic, and I'm autistic like this. And I think actually that is important for all autistic people to communicate with their doctors, because you could be very well aware of what autism means, but if you don't know about sensory overload, although probably you would know about sensory overload, but if you don't know about, you know, people taking things very literally, maybe that would be something that you could say, okay, I take things literally, so if you say, don't go overboard on the peas or whatever, I don't know, peas, I'd be like, oh, okay, I'm not gonna eat any peas at all. That was just an example. I'm not someone who takes things very literally, but if somebody is giving me medical advice, I will take that one literally, and I will follow it to the T. I made a document, and I thought that might be something actually I could share with you guys. I need to refine it a little bit before then, but maybe for the second or third trimester videos, which I'm planning to do, I'll put a link to the document, which sort of gives you an idea of the kind of things that you can write, because I also talked about communication, saying like face blindness. Obviously everybody's wearing masks at the moment, so I've got no clue who anyone is. Meeting somebody and like not remembering their name, not remembering their face, and then having to meet loads of different people, and just making it clear that I don't recognize people very well, and that's not because I don't understand anything, it's just I don't. I think that spelling out your needs or your autistic traits in a way that is relevant to healthcare providers is quite an important part, and I'm really glad that I have my diagnosis now so I can do that. For me, dealing with doctors and dealing with the administrative burden of organising a pregnancy, I don't know how it is in other countries, but here you have to organise your midwives. You sometimes have to organise appointments with the hospital. You have to organise blood tests separately. Everything is a different thing. I also decided this time that I wanted to go for a doula, so I have organised that separately. And it's like, and then you have what's called Kramzorg here, which is maternity care, and that's after the baby's born. You have to organise that, and it's like there is so much to do, and the extra admin is actually like quite stressful when you're exhausted because you're in your first trimester. Luckily, most of that is pretty much organized now, but I have to say I find dealing with doctors the most stressful thing. And the thing that I have come to realize is that, I don't like this phrase, but playing the autism card has more chance of getting you what you want than trying to convince people that they're wrong, because they will never admit that they're wrong. And especially when they tell me things that I look up and I'm like, well, that's demonstrably false. I got into these arguments last time, and I was trying to put myself in a position where I didn't get into them this time, and I found that actually just saying, well, I'm autistic and I need a quiet space is more effective than saying, I don't want to give birth in your hospital because I fundamentally don't trust your judgment. There's a subtlety to it. So I know that a lot of you are thinking about maybe wanting to have babies in the future, and maybe you're a bit like, oh, I don't know if I can, or I don't know if I'll be able to handle it. And that's kind of something that I've heard from a lot of people. And I just want to say that obviously physically speaking, I don't know, there are some conditions that you will have a harder time being pregnant, especially with regards to connective tissue disorders like EDS, which are comorbid with autism, of course. But in terms of handling it, I think it really depends on your immediate support system, your partner, maybe your close family and friends. Can they help you in a way that you need? I mean, I've had so many times during this pregnancy that I've been crying to my husband. I'm just like, I don't want to be pregnant anymore, but I do want the baby at the end. So you kind of have to do it. And this way of thinking that you just have to find a way to get through it, I think is an important mindset to have, as well as being just incredibly caring and nurturing towards yourself in that time. Taking care of yourself is literally, and just being gentle with yourself is probably the best advice that I would give anyone thinking about getting pregnant but worrying that they wouldn't be able to handle it very well. It's tough physically and mentally, and society expects you to be one way about pregnancy, and I'm too busy, even right now in my sort of glowing second trimester, I'm too busy thinking about the fact that I've been getting a headache during filming this, that I'll need to go and lie down afterwards. My belly is stretching. I have so much going on in my body that I can't even look forward to, what's to come. So my advice would just be to really take care of yourself, and especially if there is anyone pregnant watching this, I hope that your pregnancies are going well. I hope that you get the rest and the care that you need, and we all stay safe during this time when the pandemic is still going on, and it's kind of a bit of a scary time to be pregnant, actually. So let me know your thoughts in the comments below, and take care of yourselves, and I'll see you next time. Bye.